What's up, everybody? This is the Everything Medicare Podcast, episode 87. I'm your host, Christian Brindle, where every single week I bring you multiple podcasts where we discuss your Medicare, your Medicaid, your Social Security, and everything that has to do with that golden age called retirement. And folks, as this podcast starts to grow, as the audience continues to grow, as more of you are listening each and every week, we're going to be implementing positive changes to the podcast. I wanted to start off by just keeping you aware of that. We're contemplating the idea of continuing doing the audio version like we do here on every platform that you're listening to us on: Apple Podcasts, Google Cast, Spotify, Anchor, Castbox, all these different platforms. We're on a lot of different platforms. I think about 15. But continuing to do that. But we've been putting the audio up on YouTube, on our YouTube channel, and taking the advertisements out, which I've gotten positive feedback about, so I'm glad. But we're also contemplating possibly shooting video of me as I do the podcast and putting that up on YouTube instead. Kind of doing it like a web show on top of it. Not sure yet, but we might start doing a particular YouTube show. We are contemplating and kind of funneling around with the idea of doing that. So stay tuned for that. We will have more information on that to come. I'm thinking if we did do it, it'd be called something along the lines of Medicare empowerment, because I love the term empowerment, because empowerment is something to where the power is being put in your hands. The power isn't being put in my hands. The power isn't being put in an insurance company's hands or anybody else's hands. The power is being put in your hands specifically on what you want to do and how you want to do it, and just being educated on how different types of programs work. Okay? So basically, stay tuned. Today, I wanted to talk about a change that's affected Medicare's website that I have preached over the years to use. That's going to impact every single one of you that uses that website that's taken my advice. So in the past, Medicare is a website called www.medicare.gov. Okay, so medicare.gov works something along the lines of this. That you can do a lot of different things on there. There's a lot of good information about Medicare on there. But basically, in my opinion, its most valuable feature is the ability to compare your prescriptions with the plans in your area. It's completely unbiased. It shows you every single plan in your state from every single insurance company, and it shows you which one will cover your prescriptions best, which ones will cover them worst if they're covered on the formulary. And you can actually see the coverage so specifically that it's down to the very last detail as far as the copay is concerned, deductibles. You can see if there's prior authorizations. You can see a tremendous amount of information on your medication. So I've always told people, if you want to check and see, if you're getting the best prescription plan, that's the best way to go about it. That's the system that we use here. We've used softwares over the years and things like that. Nothing has ever been as good as medicare.gov, but they're changing it a lot, okay? So what they're doing, and I just recently found out about this, what medicare.gov is doing starting October 1st is my understanding. And I don't know everything. I don't know all the details on this yet. I'll talk about it more as I know more, but from my understanding, they're making a change starting October 1st that will make it to where, the most valuable, you'll still be able to type in your prescriptions one by one and look them back up. The valuable resource of medicare.gov is, in the past, they've generated a code for you. So as long as you have the code, the date you put in the list, and a zip code, you could always enter that information back in, and the list of prescriptions you entered in would repopulate on the website, and you wouldn't have to type them all in. And if you take any significant amount of prescriptions, it's really valuable. It saves a lot of time. We use it, obviously, because we check our clients' prescriptions year in and year out, and it just helps a lot to not have to re-enter a lot of prescriptions. Obviously, if someone's prescriptions have changed, they stop taking one or taking a new one, we can take one out or add a new one or do whatever we need to do. But it's just a lot less time-consuming, because most people take relatively the same drugs year in and year out. Like I said, there might be minor changes. So that's helped us a lot. It's helped our customers a lot. What they're changing is you'll still be able to type in the prescriptions and search them, but you won't be able to save the list. What they'll do is they're going to start make it where they want you to create an account on medicare.gov. And with this account, you can log in and see your prescriptions saved in that way. Just a little bit of an extra step. So I just wanted to make sure everybody was aware of that. And I believe, to my understanding, is there's some extra features that they're going to be adding in that. So they're going to take away some of the features as far as, saving your prescription list, but amongst some other things that I just don't know all the details yet, but you will only be able to access those features by creating an account and logging in and out each and every time. It's not something where you'll have a code where you can just enter the code in from anywhere and it will repopulate. So it's just a different step. More or less, it's the same thing if you think about it, but it's important that everybody is aware of that. I have a video up on YouTube that goes step by step on how to compare your prescriptions on medicare.gov. That video is still going to be current. It's still going to be accurate. The only thing that will be inaccurate and dated about it, if you ever go and watch it, is that you can't use that code any longer. And I don't know how I could really update the video, to be completely honest with you, because me not being Medicare eligible, it wouldn't let me create an account myself anyway. And unless I used, one of our clients that granted me permission, but I would never do that, because then her login information would be on the internet for all to see. Or that person, I should say. So I'm not going to do that. So we're not going to create an updated version of that video for that reason specifically. However, this is an important thing you need to know, because as soon as October 1st rolls around, to my understanding, this change will be implemented. Stay with me into segment 2, and we'll talk about what this means going forward. Don't go anywhere. Welcome back, folks. Thanks for sticking with us. So this is the Everything Medicare Podcast. In this episode, I'm talking about medicare.gov and the change that's being implemented. So basically what this is going to mean more than anything, folks, is for me as someone's agent, and probably agents all over the country, people that do their job, that compare your prescriptions year in and year out, that just make sure that you're up to date with everything, that remain in communication with you. What it means is, quite simply, that they will not be able to kind of keep that code and re-enter it in and easily compare your prescriptions. One of two things is going to have to happen, and this matters because most of the people listening to this use an agent. Now, if your agent's not in the picture anymore, or they just haven't remained to help you, I'm sorry to hear that. That's really tragic. It's really unfortunate, because they're getting paid, compensated yearly to take care of you. So you might want to find a new agent at that point, one that's going to do that person's job right. But I digress. We're talking about how this is going to impact your agents. And this matters because, the easier it is for your agent to help you, the easier it is for you to be helped, and the more help you're going to get, 9 times out of 10. So an agent, I know this for a fact, that agents all across the country use this system, and they use these codes that save your medication list, and they use them to be able to re-enter them and easily re-compare your prescriptions year in and year out. It's how they do them in bulk and compare it for a lot of their clients, because that's how we do it here. What this means for your agent is they're going to have to re-enter your prescriptions one by one. They're going to have to get an updated list of your medications each and every year, probably, unless they can save them on files. That's what we're going to probably have to start doing. Or they're going to have to keep the login information for your Medicare account. And whether you're comfortable with that, I can't say. I can understand that being sketchy. Probably what we're going to do here is we're just going to keep a list of that person's medications and ask them if they've changed when we do need to compare them. But that matters, folks. You're probably going to have more and more agents want to keep and hang on to your login information so they can log in on your behalf and check your medications each and every year. I mean, It's probably fine if you have a good agent, but who's to say? Can you really trust this person? That's up to you to decide, but I wanted to just give you an expectation that you might have that being a request that you didn't have going forward. I don't think we're going to do that here, just because the liability, folks. We don't ever want anyone thinking we have access to personal information of theirs other than on their insurance policy, obviously, because we keep track of their policy and make sure everything's going fine. But you see where I'm going with this. You want to be careful with those kind of things, and it's probably fine if you have a good agent, you can trust them. But if you don't have a good agent, be careful. That's all I can tell you. Be careful. We don't particularly know what you'll be able to do in this with this account when you log in. I think they have a way to create an account now and log in. So maybe there's a way for me to find that out. But off the top of my head, I don't know exactly what you can and cannot do in that account. So just be careful. Make sure that you trust this person if you're going to give them that login information. Okay, but that's probably going to be the change that affects you the most. If you've been using the codes to save your prescription list to compare your own medications, it'll affect you because you have to create an account if you haven't already, and that's how you'll be needing to do this. Now, keep in mind, this change doesn't take effect until October 1st. If your agent does it for you, then they might be asking for your login info. They might want to keep it on files. So just my best advice is use your best judgment. Do you trust this person? And if you don't, why are they your agent? Why are they your agent if you don't trust them? If you don't think they have your best interest in mind? If you have an agent that you don't necessarily trust to have your login information for that, you probably should think about getting a new agent in general, because there's a different problem in the works here. And that is, you might not have an agent, because if you don't trust them with that, you probably don't trust them with other things. You don't need that. You need somebody that you can believe in, rely on, and trust in. So that's how this is going to impact you, folks. It's important that you know this. Thank you so much for listening. And as always, folks, please give us a 5-star review on every platform you're listening to this on. I'm still doing our free Medicare guidance book giveaway until the end of the month. All you have to do is go to Apple Podcasts. If you have an iPhone, there's a purple app that says Podcasts. You can go on there. If you're listening to us on there, leave us a 5-star review, take a picture of it, send it to me in an email at ChristianB, ChristianBian, B as in boy, at xmission.com. X, then the word mission, MISSION.com. ChristianB at xmission.com. Include your first name and the best address we can send it to, and I'll ship it to you free, no charge to you, as a thank you. At the end of this month, at the end of August, we will not be doing this any longer. The only way to get Medicare guidance after that point will be on Amazon, where you have to pay for it. Or if you're a client of mine, I provide one to you for free at your request. So keep that in mind. Don't miss out on this book giveaway. We want to send out as many free books as we can. We'll send them to you anywhere in the country, all 50 states that you're in. So keep that in mind. As always, folks, if you're on Medicare and you'd like to work with me, we work with people we work with people in Utah, where I live, Florida, Idaho, and Oregon. Okay, Oregon's the newest state. So those are the 4 states we work with people in. If you'd like to talk with me, free consultation, 801-255-5340, 801-255-5340. That's our office number. Ask for Christian. No cost, no obligation. If nothing else, we can at least just verify that you're on the best thing for you. We work with all of the different insurance companies in the marketplace and all of the different plans that are available. So our job is to sort through the options, find you the best options based on your specific needs and preferences. We'd love to talk with you. I'd love to be able to help you if you could use it. If you feel like you need help, I'm your guy. I'd be happy to talk with you about it. I can't help everybody, but at the very least, like I said, we can cement that you're on the best thing for you. And that's the nice thing about that. You can sleep better at night knowing that you're taken care of. As always, folks, follow us on social media. We're doing 3 educational Medicare YouTube videos per week. We're having the same schedule as we do for podcasts, and that's Monday, Wednesday, and Saturday. So head over to our YouTube channel, subscribe for future content, and watch some of our videos. And you can take a look at my dashing face at that point. Actually, it's not very dashing, but there's worse looking people than me. We'll put it that way. Thanks for listening, folks. Next week, we'll be bringing you a great interview with Eric Fiaro. If you don't know Eric runs a Medicare call center, his organization works with people all over the country. Very excited to talk to him, so watch out for that interview next week. Take care.